Dr. Azar-Dickens with Enforce Health. Our topic today is going to be counseling, specific to police officers. I often am asked by officers whether or not a situation that they're experiencing or a problem that they're having is something that they might benefit in seeking counseling to address. And to be honest with you, there is no exact correct answer for everyone. It depends on the individual, it depends on the circumstances. There's a lot of hesitancy in some officers to pursue counseling. Some officers have tried it before and it hasn't worked out. Then maybe they saw someone that wasn't comfortable to them or that they weren't comfortable with specifically, and it didn't pan out very well, and therefore they've sort of have a negative taste in their mouth specific to counseling intervention. But the question is counseling effective for police officers, and is it something that should be sought out, and if so, when? Certainly we deal with things on the job that are stressful, that are difficult to manage, that create a lot of emotional distress. We see traumatic events that occur that really kind of shock the conscience in many cases, and we find ourselves thinking about that for days. It might interfere with our sleeping, and it could even affect our relationships. Some problems can be well addressed by seeking out peers to talk to, colleagues, trusted supervisors, those kinds of things. Other difficulties can be more significant and can lead us to the point in which we find that it really impacts our daily lives. And I think at that point is where we need to consider, is it time for professional intervention? And so if, let's say, for example, you find yourself, you've felt sad, that sadness has increased over time. You find now that sadness is interfering with your ability to sleep successfully. You're waking frequently through the night. You've maybe lost your appetite. If you're a drinker, you found that you're drinking more than normal. It's affected your relationship. Maybe you're more irritable with other people. At that point, that might be a time to consider, hey, I think professional intervention might be useful for me. With traumatic incidents, it's pretty typical for human beings when they experience traumatic events to have some difficulty sleeping, some frequent memories of the event, to experience anxiety. That can persist over time for several days, even for a week. That's pretty normal. Those things will usually subside, and especially in talking to other people and receiving support. But if you find that the traumatic event continues to stay with you, you're finding that it's interfering with your sleep, that you're having memories that intrude into your daily life, and that persists for a period of weeks, then I think it's time to seek professional counseling and support. There's some great therapies out there for traumatic stress kinds of issues. There's some great interventions for depression, anxiety problems, stress-related problems. Officers are often prone to stress-related conditions, whether that be physical conditions or psychological conditions. I mean, hey, look, this is a difficult job we do. We deal with difficult people. We deal with difficult situations. Even the politics within police departments can be very stressful. So all of that combined can really wear an officer to the point in which he or she starts to find that it interferes or impairs with their daily life, with their ability to do the job, and with their outside relationships. And so at that point, I think it's certainly useful to consider the possibility that counseling might be something that's effective and helpful. Again, how much is what's happening with you interfering with your daily life, with your job performance, with your relationships? That's really kind of the criterion to consider as to whether it's time to move into professional intervention. For a lot of people, you might go through a stressful event or a situation that is difficult for a while, but things improve over time. If they don't improve over time, and or if we find that our life is greatly impacted in a negative way by what we're experiencing, then it may be time to seek counseling. It's important to also understand that seeking out that support is by no means a weakness. A lot of officers consider it a weakness to reach out for counseling support. They think that they've done something wrong. They think that something is wrong with them, that they're, quote, crazy. But the bottom line is we're all human beings. We all have problems in our daily lives. Sometimes those problems will intrude and interfere with our functioning, and we need to seek support and to have some direction. You certainly wouldn't be questioning whether or not you hurt your ankle and went to see a physical therapist or went to see a physician about addressing that issue. You wouldn't consider yourself weak or necessarily be critical of yourself if you went and sought that support. Counseling should really be no different. Understanding that we are human beings, and that part of being a human being means that we deal with difficult situations, especially in law enforcement, that sometimes will require additional support and a professional ear and some professional direction to guide us along. So consider all of those factors as you're making that decision. Recognize also that therapy and counseling is highly effective for mood problems, anxiety problems, depression. Very effective also for traumatic stress types of issues. Relationship problems are also greatly improved with counseling and with the support of a professional counselor, whether that be as an individual or with counseling with your intimate partner. All of that can be effective and useful. So those are some things to consider. Certainly, please don't be ashamed or feel uncomfortable with the idea of seeking counseling. It is something that can be done confidentially so that others don't know about it. The therapists and the counselors who are licensed by the state have an obligation to keep what you say to them confidential and privileged unless there's been some other arrangement made with your department. But if you've sought that counseling out on your own and sought that support, there's nothing that they are going to be able to pass on to anyone about what you've said or the issues that you've had. So consider that also. Certainly something that is beneficial, is useful, and is strongly recommended. As always, please be safe doing the job that you do, and it's well appreciated. I'm Dr. Azar-Dickens with Enforce Health.